put down the eye cream for a second. If you have been layering your anti-aging actives, trying every firming cream, and still feel like nothing is touching your jowls, your neck crepiness, the hollowness under your eyes, then you've reached the skincare point of no return. I'm Dr. Sam Ellis. I've been a dermatologist for 10 years. I specialize in cosmetics in the San Francisco Bay Area, and I see patients every day who are trying to solve structural problems with topical skincare, and today we're going to fix that. By the end of this video, you'll know exactly what skincare can actually treat, what requires a dermatologist visit, and when a surgical consult is necessary. A quick note before we get into it, this video is for people who have cosmetic aging concerns and want honest answers. How you choose to age is deeply personal. There is no one right way to do it. And this is not a video about what you should do. It's just about providing accurate information so you can make the decision that's right for you. Also, the second half of this video is going to be me answering questions from subscribers on this exact topic, my office hours, so stay tuned for that. And if you like practical, straightforward skincare advice, make sure you're subscribed to the channel so you can join our awesome community here. To appropriately address skin aging, we need to understand it. In my mind, there are two completely different types of aging happening to your face, and knowing the differences will save you a lot of money and frustration. The first kind is surface aging. This is going to include things like pigmentation, sunspots, fine lines, dullness, and enlarged pores. These are aging changes happening at the epidermis and the superficial dermis, which is the top layers of your skin. This is what skincare, chemical peels, microneedling, laser resurfacing are designed for and where they work. The second type of aging is structural aging, and that is where topical things kind of hit a wall. Structural aging is really what happens under the skin. So for example, the fat pads that normally support and contour the face can deflate and descend. Also, your facial bones start to resorb. They shrink down so they don't support the overlying structures as readily. And we have this fibromuscular tissue layer that kind of connects the underlying muscles to the overlying skin. And as that weakens over time, things begin to fall down. These things all kind of happen simultaneously, and they lead to things like jowls, marionette lines, deep nasolabial folds, and hollowing or bags under the eyes. The easiest way to say this is if you're bothered by surface aging changes, skincare can probably help. But if you are bothered by structural aging changes, then we need to have a different type of conversation. Speaking of a conversation, let's talk through some of the skin concerns I get asked about the most. Jowls are one of the most common things that people are bothered by, and it is the most prime example of structural aging. What you're seeing when jowls form is descent of the fat pads that used to sit much higher in the cheek, combined with weakening of ligaments and that fibromuscular layer that used to hold everything up. I think it's why people are generally very disappointed by firming creams, because a firming cream at best is going to modestly plump the skin and stimulate a little bit of superficial collagen production. But just because you're making new collagen does not mean that you're going to be able to lift the deeper structures of the face. A cream just cannot do that, although I wish it could because it would make my job a whole lot easier. If they're super early, non-invasive skin tightening devices like SoftWave or oral therapy can be beneficial. But if you are looking in the mirror and you are pulling your face up like this and going, yep, that's the result I want, only surgery can do that. The under eye area is another place I get a ton of questions, and although eye creams do have some benefits, I want to be really specific about what eye creams can and cannot do and what expectations you should have if you are using them. Eye creams can certainly improve hydration, help with early crepiness and fine lines. They can also improve pigmentation and a little bit of puffiness if it's due to fluid retention. What they cannot do is fix hollowing or true under eye bags, which are both due to anatomical changes in the bony support and fat under the eye. These are anatomical issues going on below the skin, and an eye cream will not touch them. If there is volume loss under the eye, but the skin is really firm, we can often use a little bit of under eye filler to improve that situation. However, if the skin is also loose, then typically we are looking at combining a laser resurfacing procedure with some type of surgery to get the correction that someone is seeking. I see a lot of patients who come in from outside offices who are very unhappy with the under eye filler that they have received because they weren't really a good candidate for it in the first place. Typically it's because their injector was trying to correct this one anatomical issue of hollowness, but they weren't taking into account the other anatomical issues going on with the under eye area, and so you end up with this partial, incomplete treatment that looks unnatural. The last structural aging issue that I want to touch on are deep nasolabial folds or smile lines. And I feel like there's an important distinction to make here between deep nasolabial folds, which are due to shrinking of the bony architecture of the face combined with descent of the fat pads and loosening of the deep tissues, versus a superficial smile line, which is just due to the skin creasing and folding over time due to repeated movement. If you just have a little superficial crease, skincare can actually be very helpful, whether it's a collagen-stimulating retinoid or peptides or even just really good moisturization can make your smile lines look way better. But no skincare or peels or laser can push those fat pads back up and relieve that deep nasolabial fold. So in general, if you have early volume loss, I'm talking mild hollowness under the eyes, some flattening or loss of contour of the cheeks, that is where filler placed by an experienced injector can make a really nice difference. We're essentially using that filler to replace volume and give support where it's been lost. However, one thing I say to patients all the time is filler cannot lift your tissues. And for a lot of people, the aging changes that they're seeing in their face are not due to volume loss, they are just due to skin laxity or looseness. And if you try to address that with filler by adding volume instead of picking those descended structures back up, that is when you are going to look overfilled or unnatural. If you come in and you have jowls or sagging in the neck or drooping of the eyelids, those are all things that require surgical correction. And by no means am I a surgery pusher. You certainly do not have to do these things, but you shouldn't try and do other things in hopes of getting a surgical outcome because you won't even get close. The cosmetic dermatology sweet spot is really that superficial aging and some mild, deep structural aging improvements. So I'm thinking about things like lasers and microneedling and chemical peels to help with that superficial texture and irregular pigmentation, using little bits of filler to give support where it's been lost, but not chasing laxity correction, and then doing things like mild tightening devices to keep things in check. Those interventions can refresh a face in such a wonderful way and be an amazing complement to the skincare that you're already using, but also stay within the bounds of what's truly appropriate to do non-invasively, rather than reach for results that can truly only be achieved with surgery. Okay, I told you the second half of this video would be my subscribers' questions, so let's get into them. So subscriber at Dr. Wheezy 5224 says, I used my NuFace for a year and didn't see that it did anything. I love my LED mask. It has made a huge difference. That's not a question, but I think they're asking like, why? And this is actually such a perfect illustration of what I was talking about when it comes to surface versus structural aging interventions and why an LED mask might show you more visible improvements than something like NuFace. Microcurrent, which is what NuFace uses, is meant to stimulate muscle tone and contraction to induce lift over time. But when our face ages, it's not really a muscle issue. It's all the other tissues in the face loosening and descending, which is probably why most people find NuFace results to be subtle, if present at all. But red light therapy is a little bit of a different story. There's actually multiple studies that show that the right wavelengths of light can penetrate the superficial aspects of the skin to improve clarity and to support the skin's repair mechanisms to make the skin smoother and more radiant. So the fact that you, Dr. Wheezy, and so many people who use red light therapy for their skin notice improvements. The next question is from Jay Garkov, who asks, I do microneedling at home twice a week with a 0.5 millimeter microneedle head. Does this truly help with collagen stimulation, or do only the dermatologist microneedling treatments work? So the most studied clinical depths for anti-aging when it comes to microneedling are between 1.0 and 2.5 millimeters. That's typically the range where you are reaching the papillary and then deeper reticular dermis, which is where your fibroblasts or collagen-producing cells reside. So you just need to reach that depth to get the best collagen stimulation. At 0.5 millimeters, which is what you're using at home, you're really staying in the epidermis and the superficial aspects of the dermis, which is not a bad thing, and you might get some collagen stimulation there. We just don't have the same robust clinical support for that. It also depends where on the face you're microneedling. The skin under your eyes is super thin, so 0.5 millimeters is actually a great depth to use in that area. But when you're looking at the cheeks or the perioral area, typically in an in-office treatment, we're trying to get between 1.5 and 2.5 millimeters of depth there. So if collagen stimulation is your goal, I don't think 0.5 millimeter at-home microneedling is necessarily a bad thing or a total waste of time, but there might be more optimal results that you could achieve with a professional treatment. I also have other concerns around people doing minimally invasive treatments at home where they're creating controlled wounds in the skin, because that opens you up to things like infection and other complications complications, and I would just want you to be plugged in with a dermatologist if you're trying to do that. On to the next subscriber, Susan Jackson 5220, who is asking, is there anything other than major cosmetic surgery that you can use to improve your skin in women over 70, or is it too late and just a waste of time and money? The first thing I'm gonna say is age truly is just a number. What a woman in her 70s skin looks like depends so much on her genetics, her environmental exposures, and her overall health. And what's realistic in terms of results not only depends on the degree of aging, but which specific aging features you're hoping to address. If you're bothered by surface concerns, whether that's brown spots, broken blood vessels, enlarged pores, fine lines and wrinkles, dullness, those are absolutely things that can be improved through non-surgical interventions. Things like lasers and peels and microneedling can make a tremendous difference in skin evenness and quality of the skin, no matter how old you are. Also, skincare things like topical retinoids and pigment fighters and sunscreen still count and are still meaningful things to keep in your routine. But if your concerns in your 70s are deeper structural things like sagging or eye bags, those are surgical. So the question really isn't, are you too old? It's just, what's bothering you? Now, the goal of this video was not to make you feel like skincare doesn't work, but knowing the limits of what a cream can do is valuable information. Having realistic expectations can help you make smarter decisions when it comes to deciding where to invest. Tell me in the comments, what's one aging concern that you've been trying to solve or you did solve, and tell us how you did it. And let me know what you want me to cover in my future office hours. As always, thank you so much for being here. Don't forget to like the video and subscribe to the channel, and I'll see you next time.